Perspective with Mike and Amy. My name is Mike Thomas, and with me is my co-host, Amy Bishop. And this program is part of an education series through the St. Clair County Speak Youth Coalition and is funded in part by Region 10 in partnership with the St. Clair County Health Department and local organizations in the Blue Water area. Last week, we talked a bit about how to handle the challenges of doing school from home. And basically, this week, we wanted to look a little bit more specific into some of the negative effects of drugs that are used by teens. Let's be honest, there's a lot of children out there that are familiar with drug talks, and they're going to be able to tell if their parents really don't know what's going on. I mean, many of us grew up with the DARE program or Say No to Drug campaigns or Scared Straight type programs. And since that time, a lot of new information has come in on how to share information. What we wanted to do today is basically give you some straight facts on what's going on in our local area, and then talk to you specifically about what are some of the specific negative effects of drugs that our children use. So Amy, I know you with the health department have had a chance to work for a while and learn more about the MiFi data. Can you talk to us a little bit about what MiFi is and share some of our local stats for us?
Of course. The MiFi is a survey that is administered to 7th, 9th, and 11th grade students in our local area. And I'm just so thankful that the schools participate, because if we don't have the data of what's going on in our own community, it's really hard to judge where we stand now. It's hard to see if we've made any progress. So, and also it drives home the fact that these drugs are in our community, in our students' lives. Even if your specific student didn't report that they participated in various drugs, these statistics help us understand that most likely some of your students' friends have participated in that. So the influence is still in their environment. So I would like to share the MiFi data. First of all, the MiFi stands for the Michigan oh boy, I'm forgetting what it stands for, but the Michigan Profile for Healthy Youth. That's what it stands for. So 5% of our 7th graders took prescription painkillers not prescribed to them. And that was reported recently. Whereas once the students got into 9th grade and we surveyed them again, 38% said that they had ever drank, but I don't have prescription drugs on that. So, and in 11th grade, 56% reported that they had ever drank. So we see kind of that in the middle school age, it's 38%, and then in the high school, it's 56% as far as drank alcohol. So we see that, of course, rise as the age rises. I'm not sure, maybe we can follow up on why I don't have the prescription painkillers as far as the 9th and 11th grade, but I can look into that. As far as vaping, 7% of our 7th graders reported that they vaped recently, whereas in 9th grade, it went up to 21%. And then in our 11th grade question, it was 30%. So we're seeing that increase with age too. And that 30%, quite frankly, is one of the reasons that our coalition has focused on vaping, because that can be very dangerous. And it isn't just harmless vapor. It's actually most times has some sort of nicotine in it, and other drugs can be put in that as well. And 30% is a pretty high number. As far as injecting an illegal drug, 7th grade, 7% of them reported have ever done that. And in 9th grade, I don't have a statistic for that, unfortunately. I'm sorry, that's one I'll have to look up because these are hot off the press. And then I don't have that for 9th grade either, but what I do have is marijuana use in 9th grade as 20%, and in 11th grade, I have 37%. That's again very high, and we'd really like to see those numbers come down. Interestingly enough, of course, we know that substance use can definitely impact our judgment and makes us do things sometimes that we would have otherwise never have done. So when you look at experiencing like physical dating abuse in 9th grade, 12% reported that has happened to them. And in 12th or 11th grade, 1 in 10 had reported some sort of physical dating violence. And again, that's traumatic, and we're going to talk about that in some of our latter sessions as far as trauma. And let's see, depression. I wanted to talk about that too, as we know that lots of times students and adults, really, we turn to unhealthy coping when it comes to making ourselves feel better if we're experiencing depression or emotional problems. So we surveyed the students, and in 9th grade, we had 40% report some sort of depression in the past year. That's a really high number, especially for a 9th grader. And then when we came over into 11th grade, that still stayed the same. It didn't go down. So 40% across the board with that. And then 24% considered suicide in the past year. And I have that for 9th grade, but not for 11th. So I don't think all of our information has come in yet. But 24%, that's a quarter of those that were depressed. That number is too high, and we need this to change. So I think it's so important that we remember that in all of our messaging, it can't just be don't do this, don't do that. It has to be giving the students tools on how to cope healthier, how to open up and talk to somebody, ask for help. So we, at the end of the show, we always put on resources and agencies that can help. So they can look through and see those resources and link our students up with some help. Sometimes it's hard as a parent, myself, to admit that there's a problem and you think that you can handle it. But you know what? It takes a whole community to raise a child, and that's why we have wonderful resources in our area to help. It takes a community, and so reaching out for help is not a bad thing. It helps our students feel successful and learn to manage what right now is really difficult times for our students. So that's it on the Wi-Fi.
Amy, I was curious too, how do you think we compare St. Clair County versus other parts of the state? Are we doing okay? I mean, it sounds like those numbers are pretty high, but comparatively, like where are we at compared to other parts of the entire state?
I can certainly research that, although I remember last year looking into that, and in some categories, we actually were doing better than other areas in Michigan and in the nation. So, but as soon as I say that, you know, like I think our drinking wasn't as bad as in other areas, which, wow, that was a relief. But as soon as we take our focus off of that and don't focus on preventing that, I fear that those numbers will come up. So I think that we have to stay a steady force. Yes, that's good news that, you know, our students are making great decisions and we're proud of them, but I think prevention always has to be a strong force to keep every grade coming up and the message, you know, out front and center.
Okay, so I want to talk briefly a bit about some of the specific categories of drugs and look at some of the effects. And so with any drug, one thing we want to point out is that when you're bringing drugs into a developing brain, there's a lot of issues right there with that. Children are vulnerable to a lot of different things. And so as we expose them earlier to substances, that can create longer term problems. Our brains, I kind of like to use the reference, if you think of like going mudding, like going two-tracking, for example. The deeper you go, the more you use that pathway, the deeper the ruts get. And when those ruts get too deep, without the right help, sometimes you get stuck. And if we develop those habits early on, our children can be definitely vulnerable to thinking that they need these things. Our brains are designed to give us pleasure and other chemical connections when they use these drugs, which really affect their lifelong habits. And so the earlier that we use these things, the more likely they can become addicted to them. And so with that said, let's look at some of the particulars. First off, we're going to look at the ones that we primarily talk about. Number one being alcohol. Alcohol is a drug that is highly accessible because it's legal and because a lot of parents have it. We talked a little bit about that just a week or so ago. But some of the realities with alcohol is a depressant, and alcohol over excessive periods of time, the more you consume it actually in a sitting, the more likely you're going to see a lot of different delays. And children are especially vulnerable to that, okay? And in some cases, they're finding more so with girls than boys in that how men and women digest alcohol is different. So that way girls can actually get drunk quicker using less. I don't know if a lot of people knew that or not, but with that said, you'll see problems with speech patterns, cognitive issues, making worse choices, inhibitions being lowered as a result of people wanting to drink. And so if you drink too much, it can actually kill you. And that's part of the scary part of it. It can get to a point where basically you can go into a coma and die if you drink too much. For a 100-pound male or female, 10 drinks could do that within an hour. So it's really important that our children stay away from alcohol, not just for the short term, but also for the long term as well too. See, with the long term effects, part of that problem with that is not just the addiction, but the damage that's done to our organs. Alcohol is one of the only drugs that actually negatively affects every single organ system in our body. And over a long period of time, you can see substantial damage to your heart, your brain, even your lungs, but especially with your liver and other filter organs. So that drug right there is a real problem. Amy, do you have any other thoughts on that?
Well, people over time can definitely do damage to their liver, and they call the liver because you can't live without it. And so you might deal with chronic liver disease where there's scarring or cirrhosis and liver shutdown, and your body can't live with it. And many alcoholics die of that. It's a serious thing, and not to mention that the accidents, injuries, and motor vehicle crashes where people also die. So alcohol is definitely, it might seem benign, but it's number one killer as far as that goes.
And next, we're going to talk a little bit about tobacco. Now, we've had a lot of information on tobacco for quite some time. So without going into too much detail with that, tobacco is one of those ones that basically is, the use of it is one of the leading factors of death there is. 1/5 of most of all deaths in America are contributed to cigarette smoke. And so we're going to start to see that number go down as smoking decreases. But at this point right now, especially with older generations, 1/5 of our deaths are attributed to smoking cigarettes. Okay. And that's basically nearly a third of all cancer and 80% of all lung cancer associated with that. But beyond that, there's other effects as well too. Not just with the yellowing of teeth and eyes, but other problems that are associated. Stillbirths are a big problem with that. So people when they're smoking young, if they have children, that could be a problem. Problems with your heart long term. These are significant issues associated with that. And the problem we're having now is, in many cases, we're switching away from the paper products and going to the vapes, and people are thinking, well, it's not as much of a problem because it's not the paper product, which has more chemicals, so it should be safer. We don't know exactly what's inside of vapes. We talked a little bit about that before, and the truth is, when you smoke using a vape product, it's not just vapor, it's actually an aerosol. And that can actually, when the elements are heated up, you can end up breathing in toxic metals, which over a period of time can do some damage to your lungs. Several people have exhibited problems with smoking and having breathing issues, always feeling like basically like they're phlegmy or coughing a lot. And beyond that, we don't know a lot of the details. There could be other things, especially with the chemicals inside of vapes, that could be definitely toxic. Or as we saw with THC vapes not too long ago, E-Valley was a problem because of some of the ingredients that are in there. When they heat up, they're not meant for human consumption when they're burned. And so that could be a real problem as well. Anything else you want to say on that, Amy?
No, I definitely agree. Smoking has it's just coming in a different form. And it's still an issue. And it is, like you say, it's up among the top killers. And when I said before that alcohol was the top, I meant as far as injuries and death, as far as motor vehicle crashes for our teenage groups. So yes, smoking overall usually develops into a lifelong battle of quitting. And I've talked to smokers that it's highly addictive, no matter what form it takes. So I've talked to smokers so many times about that struggle, and it just is a continual battle. And the ones that have been successful on quitting, they say, it's not I quit, it's I quit every day. It's a choice that they have to make every day. So the best advice I have as a nurse to tell people is just don't start. It's one less thing you have to do. You don't have to struggle with quitting, because everybody eventually has to quit.
And it doesn't save you any money either. It's over $200 a month at a pack a day. So there's no reason to have to spend that much on something that's at its core going to be more destructive than helpful, because there is no real benefit to using it. So here's another one. And this next one with marijuana, here's the thing. There's a lot of misinformation that's out there. I know I've been looking at a lot of the billboards and we're getting some better information. If you ever look at the billboards, the electronic ones, we've got a lot of info. You can look on the health department. They'll explain some information with that as well too. But here's the thing with marijuana. There's multiple elements inside of that plant, and some of them have some medicinal value, and there's other things that are just going to be psychoactive. Okay. And so there's a few issues with marijuana that we talk about when we're looking at negative effects. Okay. First off, with the developing brain, we already said addictive potentials there. So the earlier that a child smokes, the more likely they can be addicted to it. And even though some of the symptoms associated with withdrawal from marijuana aren't as substantial as heroin, it's not just an easy thing to get rid of. I mean, people have had blurry vision, other problems when they're trying to get off of marijuana. And it doubles your chance of you being addicted when you start young versus when you start when you're older. So beyond that, a few other things. With people trying different forms, like when they're dabbing or when they're using high concentrates of THC, one common problem lately is cannabinoid hyperemesis syndrome. And way they basically get really abnormal cramping in their abdomen, which creates a lot of uncomfortable feelings. A lot of people are hospitalized as a result of it. Okay, so that's a problem. If you have a heart problem, there have been cases where, and again, these are not as significant as others, but there have been people that have had heart attacks and have passed away from having complications because they have underlying heart issues. So if your child has a heart issue, that could be a problem. It actually fluctuates your blood pressure, and some people have had heart attacks. In fact, young children eating edibles out in Colorado, they've had at least 3 deaths attributed to kids seeing their parents' gummies, thinking they're candy, they leave them out, and then they eat them, and then they end up having heart attacks. So that's a risk.
Here's our other message, Mike. Lock it up. Lock it up.
Yeah. It looks like candy to kids. Sorry, just want to mention that. But beyond that, too, smoking. Smoke of any kind is not good for you, folks. Whether it's being around a bonfire too long, wood burning stoves in your house, vapes, cigarettes, or even marijuana, long term, there's risk for your lungs. And well, there's not a lot of data to suggest that long term there's connections with cancer. That's just because we're limited with the data. We don't know. A lot of that information is not readily available. We're starting to now get some information because Michigan and other states have legalized it, but federally it's still illegal, and smoking is not good in any way, shape, or form. Long term, you're going to have an issue with lung damage. Okay. And now that might not be cancer, but that could be COPD, that could be bronchitis. Marijuana is a type of drug that can pass fungal infection as you use it. So there's some risk with that as well, too. And when people eat it, it's more potent. It takes longer to set in, but when they eat it, there's more potency. So what happens is sometimes kids think, well, maybe I'll just eat a little bit more, I'll get a better high. They eat too much. And an overdose with marijuana could come with all kinds of different, it's not an overdose where you're going to die like some other drugs per se, but there can be some definite risk with that. Aside from the cramping, there can just be some paranoia and other issues, which if you're operating machinery, that processing issue in your brain can be affected. And people have been known to, while using marijuana, get into significant car accidents or, problems with operating heavy machinery. So marijuana is not just the safe thing. Okay. If you're going to use it medicinally, talk with your doctor about that, because CBD in many ways might be somewhat helpful with certain things like epilepsy and that, but THC in high enough concentrates can definitely have some issues. And that includes anxiety, in some cases depression, or in young teens might bring on schizophrenia earlier than what they might normally be dealing with. I don't know if a lot of people know that or not. So it is psychoactive. So understand that, and the smoke, not always a good thing. Any thoughts on that, Amy?
Well, I just want to point out that when we have a developing brain, things change that way. We have more harmful effects. We're more concerned about it in students that, their brains are still developing. And so we've got adolescents that are forming their higher level of thinking in the cortex of their brain, so the frontal cortex, that judgment, that consequences, understanding that there are consequences for certain actions, feeling that, oh, nothing can harm me. All of those are adolescent thoughts just now forming into adulthood thoughts. And so marijuana, what that can do is it can impact those connections and stunt growth that way, so that there can be long-term memory issues, battles cognitively. So when you introduce those drugs like marijuana into the, what we feel is more of a benign or has been, okayed for adult use. When you introduce that into a young developing mind, there's been very few studies done, but the ones that have been done, that's the concern. We already have teens that were concerned that are not making good judgment calls because their minds haven't totally developed that way. And we want to do everything so that we have the best outcome and the most successful student as possible. So we want to protect that brain, that developing brain.
And it looks like we're pretty close to running out of time. So what we're going to do is next week, what we'd like to do is go through and finish up some of the other substances and talk a little bit about ways that you can determine whether or not your child is actually using. There's some common telltale signs that your children might be showing if they're using or not. So we want to talk about that. And basically, again, if you guys have any questions, feel free to comment in the comment section below. We're available on Instagram and Facebook. You can also access us by using speak@stclaircounty.gov. And when we talk next week, we're going to go into some more of these other substances. Pardon?
.org.
Oh, .org. I'm sorry. I keep thinking .gov, but .org. So speak@stclaircounty.org. And we're going to talk about that. And we'll also leave a reference to the help card somewhere, a link to that in our box as well. So that way you guys can access that information. But we thank you very much. Have a great day. And we'll look forward to seeing you next week. Thanks a lot.
Till then.